When it comes to treating your mental health, maybe you've tried the traditional route. Maybe you've gone to counseling and it's not working for you. So we wanted to explore today some other possibilities when it comes to treating your mental health. Tricia Pease is the COO of Serenity Mental Health. Dr. Brad Zehring, a psychiatrist here as well. Both of you, welcome. You know, Tricia, I want to start with you because your personal story is so powerful. Tell us a little bit about your personal story and how you guys went off the beaten path to get help.
So back in 2011, my husband and I lost our second oldest in a car accident. And as we watched our family go through that grieving process, the trauma of that loss, we realized we weren't getting enough relief. We weren't getting the help we needed through traditional mental health avenues like therapy and medication. And our very good friend, Dr. Tripp, approached us about transcranial magnetic stimulation, or TMS. And we ended up doing that with myself, my husband, our oldest children, to get relief. And it really restored our mental health back to a healthy balance. And so the idea that we could do that for so many other people who are suffering, for loved ones we had, for friends and family who had gone through their own mental health journey, we wanted to offer interventional psychiatry, which basically means that each patient gets a holistic treatment plan individualized for their personal needs. And so for us, Serenity is a very personal mission where we get to provide relief to people who are going through their own journey like we were.
So in other words, you weren't getting what you needed, and now you've started a business to provide a whole host of options for people. Is that right?
Exactly. If we look at the numbers in the United States since about 2007, we've increased the number of therapists by over 30%, and our use of psychiatric medication has significantly increased as well. But we also see the number of suicide rates going up, and we see the people struggling going up. And so what we learn from that is there's a gap. And there are people that benefit from therapy and medication, and we want them to get that benefit. And so that's why we do this holistic integration that we do. But when those aren't enough, when therapy can't get you there, when medication can't bridge that gap, we want something that can. And so that's where we use both ketamine infusions and TMS to help patients get relief that they really need.
So TMS, or transcranial magnetic stimulation, is a non-invasive, non-medication treatment option for treatment-resistant depression, obsessive-compulsive disorder, and a variety of other mental health conditions. So once a patient's approved for TMS, a helmet will be placed on their head, sending electrical pulses, similar to MRI technology, that help propagate electrical current to targeted brain regions. There, it will stimulate nerve cell connections responsible for mood regulation, increasing activity where underactive brain areas have been. So essentially, it's really being a jump start for the brain. So ketamine is part of a psychedelic treatment option that is used to really help patients also bring nerve cells together, help grow those connections, and help them with any of their mental health conditions that they have almost in real time. It's not uncommon for a patient to get one infusion of ketamine and right after that feel instant relief.
And how do you determine what a patient needs as far as all these options are concerned?
What we do as psychiatrists or psychiatric nurse practitioners is we'll do a psychiatric evaluation. We'll look at their medical history. We'll look at their psychiatric history. We'll look at all the histories that they have and determine if they're a fit for this treatment. Where I think psychiatry is going is with neuromodulation techniques like TMS and psychedelic treatments like ketamine, because the chance at remission is so great with little to no side effects. So really we're able to give patient treatment options that are extremely helpful and that can act really quickly so they can get on living the life they want to live.
Tricia, let's bring this conversation full circle. Help me understand how Serenity fits into all of this. And please speak to people at home who are suffering, who maybe are wondering, do I even have the courage to step out and call a place like Serenity?
What we try to do here at Serenity is provide opportunities that are what we call the cutting edge of settled science. So we know they work, but it's also the newest, the latest, the greatest, so that people who've tried things maybe for 20 years, and haven't had relief, have a new hope. Our team here is built to be a support system for patients who may not have the support they need at home or, in other places. Call us, because you're not just calling a doctor, you're calling an entire support team that wants to be here to guide your healing journey to a place where you get the relief you need.
I think something you said was so beautiful, new hope. And I hope that's what people will cling on to as they listen to this conversation. Both of you, thank you so much for this important conversation, really. And at home, if you're suffering, please don't be afraid to reach out. If you want more information about Serenity, we'll put the information up on our screen. There is their website as well as their phone number.